all my life I've had asthma, and that's controlled. I have high blood pressure, diabetes. I have a genetic blood clotting disorder, factor V Leiden, which causes me to clot easier than other people, but not terribly bad. And I also have something called lower branch block, which means that the two lower chambers of my heart don't beat in unison all the time. Prior to when things really got bad at the beginning of the year, it was a real intermittent thing, barely showed up on EKGs, but now it is pervasive. And I'm on the brink of, well, I was on the brink of considering one of those monitors or whatever you put it in there, a heart pacemaker with 3 leads that was supposed to fix that, but I might not after our conversation, Laura. So what happened was we had COVID at the end of 2020, and then got through that okay. No, not even a lingering, I could smell and taste, and everything was fine with that. But towards the end of last year, around Thanksgiving, and I carried a load on a smoker outside for Thanksgiving up here in North Texas. I was really pushing hard to get it done. I had breathing problems. I was exhausted, and so I wound up couldn't take it anymore. Wound up going to the ER, and I had real low oxygen levels. I had fluid on my lungs. They put me on Lasix, and that took care of some of that. In the meantime, about 12 years ago, I had a motorcycle accident, and the lower frame of the motorcycle slammed both of my calves between itself and the pavement. And I've had swollen calves ever since. I haven't worn shorts, except for my poor wife has seen this, in public for years because my legs were so big. And I sent Laura a picture of when our grandchild was born in September. I couldn't even get my pant legs off. At the end of the day, my wife had to help me take jeans off because I couldn't find jeans with big enough calves to accommodate it. And it was just real. So I'm lugging that around, and then I get diagnosed with congestive heart failure. My heart functions down about half of what it should be. And then I got a contrast CT scan, and apparently I'm allergic to the dyes. And that caused my kidney to crash. So I went down to kidney function of 9, where 7 is the cutoff for dialysis. And they recommended me to get a kidney transplant. So I went and talked to those people. All of that is all grim. And so I had, basically 5 months of miserable news. I got tired of hearing, I didn't want a phone call from my PA or anybody. We were trying to treat it with Lasix. I was referred for lymphedema therapy, which is a type of massage therapy, and that helped. And I'm wearing compression hose. But my friend, I have a friend named Eddie and Adele Klein. I don't know if you know them, but Eddie had some success with X39 because of the after effects radiation and chemo, and they talked to me about it. Also, Donna Reiners had talked to me about it, and I did what he did. I kind of blew her off, and I wound up calling her back to apologize that I signed up under Eddie and Adele. I got that first product, and it was the 2 months of X39 and Eon. That's how you say it.
Yep.
In April, at the end of April. So it's been about 5 months that I've been on the product. I added, I was talking to Donna when I apologized, and she recommended
Glutathione.
Yeah, that. I have the hardest trouble saying. And I wear it about once every 4 days. I'll put one on under my
So what are
navel.
you noticing now that you've started wearing the patch?
Well, the X39, one of the problems I had with not reporting to Eddie and Adele was all my meds were being juggled because of a variety of things that were happening. And I wanted to have an ethical way to say, I know that something from LifeWave is making a difference before I ever called and talked to y'all. About middle of last month, I got X49 after watching a video with the founder was talking about it, and it really touched the nerve. I talked to Eddie and Dell, I got it, and within 5 days, the swelling in my legs was gone. I mean, it's completely gone. I showed Laura pictures. It's mind-blowing to me that my legs look like normal 67-year-old guy legs now, which to me has never been attractive, but it
I don't know,
sure
they
is.
kind of look 55, but if you want to go with 67, it's fine.
So anyway, I'm on the brink of having to buy pants that, shorts where I could wear it around, people and not run their life. But I noticed some other things, and my wife wrote it down in the summary that I sent you, the timeline. And it was that we came back from a trip, a 2-week trip, and I was just dragging, and I took a whole week off. This is my counseling ministry office, and I just slept a lot. And it's not like me to do that. And I slept a lot. And since then, my kidney function has increased. Some of that is because I've been behaving myself with sugar. And some of that is because I think X39, but I can't quantify it. The X49 has definitely made a big difference. My thinking's clearer. She can tell it in my affect. I irritate her. My wife's in the room. I irritate her by singing songs with all the wrong words on purpose, and I make them up as I go. And I wasn't doing anything like that. I was just sullen. I would come in, and I'm a pastoral minister. And so I'm doing what I do, and I believe in what I believe spiritually, but physically, I think we have that part too. And my physical body was feeling miserable. I feel really good. She says, I have pep in my step. I'm not completely wiped out after a long week. By Thursday night, I put in a 60-hour work week. Been doing that for years. And I come home now and I might work on something at home or
That's
do some
awesome.
writing or something. So it's been really amazing to me. What I hope to see is that it also affects my heart function, my kidney function, maybe. And then I started what you recommended. What did you recommend to me for?
Carnosine.
Carnosine. The patches will be here anytime. I'm looking for them to be here in the mail today or tomorrow, and I'm going to start that. And hopefully, my hope is that I want to be able to tell people X39, X49, carnosine, and these things have caused these changes because the meds are stable.
Wow.
And all the other stuff is stable. I'm not carrying fluid in my lungs. None of those problems right now.
Oxygen levels have come back up.
Oxygen, I just checked it. They're 98.
Yeah, that's
and I have a rescue inhaler with me. I was using it to walk in from the house into the house. I'd have to use the rescue inhaler, and some of it was just fluid on the lungs, and that's gone. Oh, also I'm a quarter of the prescribed Lasix levels now. So I
wow.
know it's not because of Lasix. It's because something's being fixed in my system. So I'm excited about it. And people who could see it in my, I'd be sitting in my office here. I wear jeans to work, and people would look at my legs, and I knew they could see. I said, yeah, I know they're swollen. And
Yeah.
but I'm not lugging that waterway around. It's got to
That's
be easier
amazing.
on the heart. So all in all, I'm really thrilled about it. And I'm excited to have a chance to share it with y'all.
And give us an update on where you are.
Something today, just watching y'all.
Yeah.
I need to start doing this like Wendy did, holding up a patch, because showing what's changed. And I have to move my hair and pull my collar back. And
Yeah.
I have this thing stuck to my back. I'm certainly not going to share the under navel ones, but I think it would be a lot cooler to have one of these in my pocket all the time.
That's right.
So if nothing else, I'll learn how to present it better.